For decades, you have been told that statins are one of the most hated medications in the world. Millions of people have stopped taking them. The reason is almost always the same: muscle pain, fatigue, brain fog, weakness. You may have experienced it yourself, that ache in your legs that started a few weeks after you filled the prescription, the exhaustion that wouldn't lift. And so you made the decision that millions of others have made. You stopped. But a massive study just analyzed more than 150,000 patients across 23 clinical trials. And what they found quietly contradicts almost everything you have been told about statin side effects. What 150,000 patients exposed about statins is going to challenge what you believe. And by the end of this video, you will understand exactly what is really happening inside your body when you take a statin, what is actually causing the symptoms you blamed on the drug, and what you should do about it starting this week. I'm Dr. Richard James, and what I'm about to share with you is one of the most important conversations happening in cardiology right now. This is not my opinion. This is peer-reviewed science from the University of Oxford, published in the Lancet in February 2026, and it should change the way every person over 60 thinks about their cholesterol medication. Here is why this matters to you personally. More than 200 million people worldwide take statins. They are among the most prescribed medications on the planet. And yet, a staggering number of people stop taking them because of side effects they believe the drug is causing. The consequences of that decision are not small. A study published in the European Heart Journal followed over 120,000 patients aged 75 and found that those who stopped taking statins had a 33% increased risk of a major cardiovascular event: heart attacks, strokes, hospitalizations that could have been prevented. If those side effects were never caused by the statin in the first place, then those events were preventable tragedies. And that is exactly what the evidence now suggests. But before I show you what this study revealed, I need you to understand something first. Because without this one piece of context, the findings don't make sense. If the statin isn't causing your muscle pain, then what is? That answer changes everything. And by the end, I'll tell you exactly what to do with this information. Whether you're currently taking a statin, whether you stopped one, or whether your doctor just recommended you start. Let me start with something I want to be very clear about. If you have ever taken a statin and felt your muscles ache, your joints stiffen, or your energy drain out of you, I believe you. Millions of people report the exact same thing. The pain is real. The fatigue is real. I am not here to tell you that what you felt was imaginary. I need you to hold that thought. Because what happens next is where this entire conversation shifts. Statins have carried a reputation for decades. You hear it from friends. You read it online. You see forums filled with people sharing horror stories about muscle pains so severe they could barely walk. Some people report memory problems. Others describe a fog that settles over their thinking and doesn't lift until they stop taking the pill. And this fear has real consequences. A study from Denmark, published in the European Heart Journal in 2016, tracked nearly 675,000 statin users and found that every negative news story about statins increased early discontinuation by 9%. People stopped taking a life-saving medication because of a headline. And that discontinuation was directly linked to increased heart attacks and cardiovascular deaths. Here is how deeply this runs. When a patient goes to their doctor and says, "My muscles hurt since I started the statin," many doctors will respond with something like, "It might be the statin." That confirmation is all it takes. So you stop. And that decision feels logical. It feels safe. It feels like you listened to your body. But here is the part that most people never question. How do you know it was the statin? You started taking a pill. You developed symptoms. You stopped the pill. The symptoms improved. That seems like an open and shut case, except it isn't. And to understand why, you need to understand one thing about how your body works after 60. As you age, muscle aches increase naturally. Joint stiffness increases. Fatigue becomes more common. These are normal biological processes driven by changes in collagen, hydration, and mitochondrial function. If you started a new medication at the same time these age-related changes were progressing, your brain will naturally connect the two. The pill caused the pain, except it didn't. The timing was coincidental. The attribution was not. Your brain is far more powerful than you think. It has the ability to create physical symptoms based on nothing more than what you expect to feel. That mechanism has a name, and understanding it will change how you see this entire debate. This is where the science takes a surprising turn. So, you felt the pain, you've heard the warnings, and you made a reasonable decision based on what you knew. But here's the problem. A study the size of a mid-sized city just proved that the majority of what people believe about statin side effects is wrong. In February 2026, researchers at the University of Oxford published the most comprehensive review of statin side effects ever conducted. It appeared in the Lancet. The study was led by the Cholesterol Treatment Trialists Collaboration and drew on data from 23 large-scale, double-blind, randomized controlled trials. More than 150,000 participants. A median follow-up of nearly 5 years. Here is what they found. Out of 66 side effects listed on statin packaging, the kind of warnings you read in the fine print, 62 of them showed no causal link to the drug. Read that again. The muscle pain, the fatigue, the memory problems, the depression, the sleep disturbances. Patients taking a sugar pill reported these symptoms at virtually the same rates as patients taking the actual statin. The people who thought they were taking a drug and the people who were taking nothing, they felt the same things. The conclusion was clear. The vast majority of symptoms patients blame on statins are not pharmacologically caused by statins. Your pain was real, but the statin probably was not the cause. Now, I want to be direct with you. There is a small group of people who do experience genuine statin-related muscle problems. About 1% for less serious muscle symptoms, and rhabdomyolysis, actual muscle breakdown, is rare but real. If you are one of them, I'll tell you exactly how to know and what to do in just a moment. But for the other 90% or more of people who blamed their symptoms on statins, the explanation lies somewhere else entirely. And that explanation is the most fascinating part of this entire story. Stay with me, because this next part is critical. If statins aren't causing the symptoms, then what is? The answer is something called the nocebo effect. You've heard of the placebo effect, where believing a treatment works can make you feel better. The nocebo effect is the exact opposite. Believing a treatment will harm you can make you feel worse. And the research shows it happens constantly with statins. Here is the mechanism, explained simply. When you expect pain, your brain activates stress pathways. Cortisol rises, muscles tense, blood flow to certain tissues changes, and the result is real, measurable physical discomfort. You are not making it up. Your brain is making it real. This is not psychology. This is neurobiology. Brain imaging studies have shown that nocebo responses activate the same pain processing regions as actual physical injury. The cholecystokinin pathways fire. Dopamine drops. Your nervous system responds to the threat it believes is real, and it creates the evidence to prove itself right. This is the part that frustrates me the most as a doctor, because the very systems designed to protect you are the ones causing the harm. Your brain reads a warning label, hears a friend's story, and begins preparing for pain before a single molecule of the drug has reached your bloodstream. This was proven directly in a landmark trial called SAMPSON, published in the Journal of the American College of Cardiology in 2021. Researchers at Imperial College London enrolled 60 patients who had stopped taking statins because of side effects. Each patient received 12 monthly medication bottles, 4 containing atorvastatin, 4 containing placebo, and 4 that were completely empty. The results were striking. Symptom scores during statin months and placebo months were nearly identical. The mean symptom intensity was 16.3 on statins and 15.4 on placebo, a difference that was not statistically significant. Both were dramatically higher than the 8.0 recorded during no-tablet months. The nocebo ratio was 0.90, meaning 90% of the symptom burden patients attributed to statins was also produced by a sugar pill. Think about that for a second. You read the side effect list on the box. You heard your neighbor say statins wrecked their joints, and before you even swallowed the first pill, your brain had already started building the pain. The expectation created the experience. And here is where it becomes deeply personal. After the SAMPSON trial ended and patients saw their own data, saw that they reported the same symptoms on placebo, half of them successfully restarted statin therapy. The knowledge alone was enough to break the cycle. So now you understand what happened. Your brain, trying to protect you, actually created the symptoms that made you stop a medication that was protecting your heart. The question is, what do you do with that information now? Because the consequences of stopping were not imaginary. Let me be direct with you. If you stopped taking a statin because your muscles hurt, and that muscle pain was nocebo-driven, then for however long you've been off the medication, your LDL cholesterol has been doing exactly what it does when nothing is controlling it. It has been building up inside your arteries, silently, progressively, without symptoms until the day it isn't silent anymore. LDL cholesterol doesn't just float around harmlessly. It penetrates the walls of your arteries. It triggers inflammation. Over months and years, it forms plaques that narrow the vessels carrying blood to your heart and brain. And here is what makes this so dangerous. You cannot feel it happening. There is no warning. There is no ache. The first symptom of advanced arterial plaque is often a heart attack. The study published in the European Heart Journal by Giral and colleagues followed 120,173 patients aged 75 who had been taking statins for at least 2 years. Those who discontinued had a 33% increased risk of any cardiovascular event and a 46% increased risk of a coronary event specifically, heart attacks, the kind that change your life in a single moment or end it. Meanwhile, the Oxford meta-analysis confirmed that statins reduce cardiovascular risk by 20 to 30%. That is the trade you made without knowing it. You gave up a 20 to 30% reduction in your risk of a heart attack or stroke because of symptoms that, in the vast majority of cases, would have occurred even if you had been swallowing a sugar pill. The irony is brutal. The side effect that wasn't real led to a risk that absolutely is. So the side effects that made you stop were likely created by your brain. But the plaque that built up while you were off the medication, that was very real. In a moment, I'll give you the exact protocol for what to do next. Now, I know what some of you are thinking. Dr. James, my pain was real. I felt it every single day. And you are right. The pain was real. What I am telling you is that the cause may not have been what you assumed. There is a small percentage of statin users, roughly 1% for clinically significant muscle symptoms, who experience genuine pharmacologically caused muscle problems. It is measurable. Your doctor can run a simple blood test called a creatine kinase test, or CK test. If that number is elevated, the statin may truly be causing muscle damage. If it is normal, the evidence overwhelmingly points to the nocebo effect. The Oxford meta-analysis itself acknowledged this. They found small but real excesses in liver enzyme changes and rare cases of myopathy. This is not a study that pretends statins have zero side effects. It is a study that precisely identifies which side effects are real and which are not. And the honest answer is that 62 out of 66 listed side effects showed no causal connection to the drug. This is not about dismissing your experience. It is about finding the right answer so you can make the right decision for your heart. So here is exactly what I want you to do. This is the protocol I give my patients, and I want you to take it seriously. If you stop taking a statin because of side effects, call your doctor this week and ask for one simple blood test, a creatine kinase test. That number will tell you whether the statin was truly damaging your muscles or whether your brain was generating the symptoms. If your CK levels are normal, talk to your doctor about trying again. A lower dose. A different statin. There are 7 different statins currently approved, and they are not all the same. They are processed by different enzymes in your liver. They have different potencies, and the side effect profiles vary between them. What caused discomfort with one may not cause any issue with another. Switching from one statin to another resolves the issue for many patients. Your doctor can also consider starting at the lowest available dose and increasing gradually. If your CK levels are elevated, that is important information too. It means you may be in the small group that experiences genuine statin-induced muscle effects. In that case, your doctor can discuss alternative cholesterol-lowering medications. There are several effective options available today, including newer drugs that work through completely different mechanisms. And if you are currently taking a statin and experiencing side effects, do not stop on your own. Talk to your doctor first. Ask for the CK test. Get the data before you make a decision that affects your cardiovascular risk for years to come. This is not about blind obedience to a medication. This is about making sure the decision you make about your heart is based on what is actually happening inside your body, not on what your brain expected to happen. Your heart has been working for you every single day of your life. It deserves a decision based on the best evidence available, and now you have it. If someone you care about stopped their statin because of side effects, share this video with them. You might be the reason they have that conversation with their doctor. You might be the reason they get the test. And you might be the reason they protect their heart for years to come. I'm Dr. Richard James. Subscribe, because next week I'm covering the real cause of statin muscle pain for the small group who does experience it, and one vitamin that may fix it completely. Take care of your heart tonight. I'll see you in the next one.